Hello everyone, we're going to go over some test-taking strategies. My name is Kate Pittman. I'm an instructor here and an academic coach at Cuyahoga Falls. And today I want to just talk to you about some test-taking strategies. Students, when you're doing NCLEX questions, you should avoid asking yourselves, well, what if? Because this leads right into the forbidden reading into the question. So many students make that mistake when we're doing NCLEX questions or even exams. You need to focus only on the information in the question, read every word, and make a decision regarding what the question is asking. You want to look for strategic words. Strategic words in the question, such as immediate or initial, first, priority, side effect, toxic effect. Strategic words make a difference with regard to what the question is asking about. In multiple choice questions, multiple response questions, or order of priority questions, students need to read every choice or option presented before answering. With questions that require fill in the blank, you guys want to focus on the information in the question and determine what the question's asking. If the question requires calculating a medication dose, an intravenous flow rate, or intake and output amounts, you need to recheck your work in calculating and always use the on-screen calculator to verify your answers. Here's just a slide of some commonly used strategic words: best, initial, early or late, most appropriate or least appropriate, first, most likely or least likely, and immediately. Students should look for strategic words in the question that indicate the need to prioritize, and to remember that when a question requires prioritization, all options may be correct. Strategies useful in prioritizing include the ABCs, Maslow's Hierarchy of Needs, and the 5 steps of the nursing process. When I say that all of the options might be correct, all of the answers really might be correct, but you have to pick which answer or what would you do first. We are going to talk about ABCs, Maslow's, and the 5 steps of the nursing process next. So ABCs. ABC method, this is a strategy that you can use when you're answering NCLEX questions. Airway, breathing, and circulation. When we're talking about prioritization, airway is always going to be the first priority, then breathing, then circulation. It's just that simple. It's called the ABC strategy, and it's airway, breathing, and circulation. This is a good visual of Maslow's hierarchy of needs. And we're going to start at the bottom of the triangle and move up. We start with physiological needs, then move to safety needs, then move to love and belonging, esteem, and self-actualization. The thing about Maslow's theory that you need to understand and know, especially when we're talking about NCLEX questions, is you cannot move to safety until a person's complete physiological needs are being met. So a person must have access to air, water, food, shelter, sleep, clothing, and reproduction in order to be able to move to a safety need. Safety needs include personal security, employment, resources, health, property. If a person's physiological needs are not met, they cannot meet their safety needs. They cannot meet the love and belonging needs. They cannot move to esteem or self-actualization. They cannot move up the ladder until that level is met. Let's say their physiological needs are met. Are all of their safety needs met? That's how we use our Maslow's hierarchy of needs strategy. Now, let's talk about the nursing process. For some of you that have me in class, you already talk about the nursing process quite a bit, but I want to teach you the acronym ADPIE. It is ADPIE, and this is the nursing process. You're going to assess or gather information, gather data, and review the patient's history, then diagnose. We're going to identify a problem list. Okay, we're just going to write a list of all the problems that we have. Then we will plan, which is developing goals, desired outcomes, and an action plan. We'll put them in priority order, and then we'll move to the I, which is implementing, or as I tell my students, I want you to memorize implementation equals interventions. So what nursing actions or what nursing interventions are we going to do for this patient? Then we move to E, which is evaluate. We're going to evaluate, did we reach our set goals? Were our desired outcomes or goals achieved? Now, how do you use the nursing process when doing NCLEX questions or exam questions? Assessment always is going to come before interventions. So if you have a question, and I'll show you guys a couple sample questions at the end, but if you have a question here and you have 3 implementations or interventions like administering a medication or ambulating the patient or encouraging coughing and deep breathing. Those are all implementations. And then the other answer was assess lung sounds. The assessment answer is always going to be right because that's going to come before the interventions. So, like I said, we'll do some questions so we can practice it. Students might be asked a question that requires deciding how to delegate a task or assign clients to other healthcare providers. Students should determine what task or assignment is to be delegated, consider the client's needs, and match the client's needs with the scope of practice of the healthcare providers identified in the question. Generally, non-invasive interventions such as skincare, range of motion exercises, ambulation, grooming, and hygiene measures can be assigned to a UAP. A licensed practical nurse can perform the tasks that a UAP can perform, and additionally can generally perform certain invasive tasks such as dressing changes, suctioning, urinary catheterization, and administering of medications orally or by subcutaneous or IM injections. Some nurse practice acts allow the licensed practical nurse to determine, to administer piggyback medications such as antibiotics. Now, the nurse can perform all of the tasks the LPN can, all of the tasks the UAP can, and is responsible for assessment and planning care, analyzing client data, implementing and evaluating client care, supervising care, initiating teaching, and administering medications IV. Students need to use nursing knowledge to answer questions. The questions will identify the generic name of the medication. If the questions identify a medical diagnosis, the student can make a relationship between the medication and the diagnosis. For example, with that, if we have a statin medication, Eventually, like as you learn all the medications, you want to be able to make that connection that a statin, the reason that we're using the statin medication is because this person has hyperlipidemia or high cholesterol, and we use um, statins for high cholesterol. Students should also try to determine the classification of the medication being addressed to determine if a medication action and or side effect. They should also use medical terminology skills to answer questions. If you are in PNR 104 or if you've had your earlier courses, you really do focus on med-term. If you are not good with medical terminology, my recommendation is learn it on your own. Start doing it on your own. Supplementally, get an app on your phone and practice your med-term. Those are keys in NCLEX questions. So students should recognize the common side effects associated with each medication classification and then relate the appropriate nursing interventions to each side effect. For example, if a side effect is hypertension, then the nursing intervention would be to monitor the blood pressure. Learn medications that belong to a classification by commonalities and their medications names. For example, bronchodilators end with line, theophylline. So we memorize the ending here, the suffix, to lead us to remember that those are bronchodilators. You should also look at the medication name and use medical terminology to determine the medication action. For example, low pressure lowers the blood pressure. The pressor, Pressor, you can remember lowers the blood pressure. If the question requires a medication calculation, remember that a calculator is available on the computer. Talk yourself through each step to be sure the answer makes sense, and recheck the calculation before answering the question, particularly if the answer seems like an unusual dosage. So it's always smart to go back and just look at the question from a logical perspective. Does it make sense that I'm going to give 1.5 tablets to this patient? Does that make sense? So just take a step back and look at the question. Generally, the client should not take an antacid with medication because the antacid will affect the absorption of the medication. Enteric-coated and sustained-release tablets should not be crushed. Additionally, capsules should not be opened. The client should never adjust or change a medication dose or abruptly stop taking a medication. The nurse never adjusts or changes the client's medication dosage and never discontinues a medication. The client needs to avoid taking any over-the-counter medications or any other medications, such as herbal preparations, unless they are approved for use by the healthcare provider. The client needs to avoid consuming alcohol. Medications are never administered if the prescription is difficult to read, is unclear, or identifies a medication dose that is not a normal one. Then we have different types of questions besides just our multiple choice. We have fill in the blank questions, that's obvious. Graphic item options. So you might have a picture and the question is asking you to identify like a landmark of maybe where you listen to the heart or something. Multiple response is our select all that apply. Chart or exhibit questions are just that, where they're going to use a chart or an exhibit. Prioritizing in a drag or drop. So you might have to put, like if they're asking you how to teach a patient to administer a inhaler, you have to put it in step order. Okay, audio questions, figures or illustrations, video questions, and the future type, or what we can expect the NCLEX to evolve to, is an unfolding case in an EHR. And here's a meme just for fun. Every week, I'm sure that you guys are done with nursing school. You probably feel quite accomplished. Keep up the good work, everyone. You are all doing very well.